This disease is known as the German measles. It is a contagious virus that can have mild symptoms in children and adults. It's a mild illness, and the symptoms rarely last more than 3 to 4 days. But it can cause death or profound congenital defects in infants born to mothers infected during their first trimester of pregnancy. It is acquired through an upper respiratory tract infection or through placental blood exchange with the mother infected during early pregnancy. Person with the illness is contagious from the 7th day of exposure through the 21st day after the last known exposure and should be isolated from pregnant women in order to prevent infection. There are many signs and symptoms that include a 12 to 24-day incubation period. Infected patients present with a low-grade fever that is often transient, with a mild rash, lymphadenopathy, conjunctivitis, cough, headache, and joint pain. The rash lasts about 3 days, originating in the face and spreading to the trunk and the limbs, but the rash can be mistaken for scarlet fever. The palate may have bright rose-colored spots, and the pharynx can be red but not sore. There can be swelling in the suboccipital and postauricular and postcervical glands, which is preceded by the rash about 5 to 10 days and may be noted by the patient when they're washing their hair. Occasional splenomegaly and hepatitis can occur, and arthritis can also be a evolved complication, especially in adult females. Who is affected? Pregnant women, children, adults, and congenital defects in newborns who did not receive the MMR vaccine can be affected by this disease. Diagnosis. An unimmunized person with a history of an exposure to rubella can be diagnosed with rubella. There is a combination of glandular swelling and an onset of a facial rash, and serological testing can confirm the disease by a 4-fold increase in specific antibodies. There is a differential diagnosis that includes allergic reaction, scarlet fever, secondary syphilis, infectious mononuclear viral infections, and Kawasaki's disease. There is no known antiviral treatment for rubella after the disease is present. To prevent rubella, an MMR immunization provides protective antibodies to 90 to 95% of those immunized at 1 year of age, with a 99% protection by the second vaccination. Adult women should practice birth control after administration of the disease in order to prevent any type of infection. Congenitally acquired rubella causes deafness in 85% of children, intrauterine growth restriction in 70%, retinopathy in 35%, in utero death in 20%, mental retardation in up to 20%, and behavioral disorders in up to 20% by age 35, including cardiac defects as well. Congenital rubella has been reported disease in the United States since 1966.